Welcome everyone to the U54 Partnership Research Design and Analysis Course Seminar. It's a mouthful. We're also known as the RDAC. I'm Carol Lowenstein. I'm the director of the RDAC, and I'll be moderating today's seminar. As many of you know, we hold a number of seminars, primarily scheduled during the academic year. We aim to highlight topics that are methods focused, as well as provide tools that will assist in the research being conducted throughout the partnership. Each seminar is recorded and posted on the partnership website. If you haven't had a chance, at some point, please do take a look at the past seminars and reach out to the presenters with any questions you might have, advice, reach out to us with ideas for future research, collaboration. Folks are there to help and continue to move research in these areas forward. In terms of housekeeping for today, I'll monitor the chat. If questions come up, we'll address those at the end. Today, we're pleased to have a panel of speakers addressing the topic of engaging older adults as research partners. I'll introduce Erin McGaffigan, who will then in turn introduce the other speakers on her panel. Dr. Erin McGaffigan is the founder and leader of Collective Insight, a certified women-owned business started in 2014 to demonstrate how effective engagement is possible and a powerful system improvement strategy. Dr. McGaffigan has extensive experience around community-based long-term services and supports for elders and people with diverse disabilities. Dr. McGaffigan received a Master of Science in Public Policy from the University of Massachusetts, Boston, and a Master of Social Work with a concentration in community organization, public policy, and administration from Boston College. She received her PhD from the University of Massachusetts, Boston, where she focused her dissertation research on the complex factors and related outcomes of community engagement practices. Erin, I'll let you take it from here.
Thank you so much, Carol, and thank you for having me. I'm just forewarning you, I just lost internet connection as I started to listen to the bio. So if I go out for any reason, Missy is here to jump on in. So thank you, Missy. Thank you, everybody, for inviting us to this wonderful presentation. I am going to go ahead and ask for next slide, Missy. And while I do that, I want to thank Jan and Mark, who are both on this, Jan Wichler and Mark Cohen, who are both on this presentation today. I'm going to give a little bit more insight of who Leading Age LTSS Center is or are, and I'll talk a little bit more briefly about them in a moment. But before that, I want to talk a little bit about our presenters, and I'm going to apologize ahead of time because I'm going to go ahead and read out loud their bios because I don't want to get a thing wrong here. So Vanessa Rorai, who's our first presenter, is the program coordinator of the Healthier Black Elders in Detroit. Vanessa supports researchers in applying to and accessing the participant resource pool, which she'll talk about today. She is the key contact for all members of the Community Advisory Board in Detroit and the over 1,100 participant resource pool members in the Detroit community. Vanessa also coordinates the Lunch and Learn programming, identifies new partners for programming and recruitment and retention activities, conducts regular training and supervised volunteers and graduate student workers, and other great functions central to the success of the program with board members, the research registry, and more, all in Detroit. Brittany Lau, MPH, is the director of the Office of Cancer Health Equity and Community Engagement at the OCHECE Carmino Center Cancer Institute at Wayne University in Detroit, Michigan. Ms. Dowe manages the day-to-day operations at OCHECE and provides leadership, consultation, program management, training, and capacity building to both increase community and participant or stakeholder engagement in cancer research and facilitate cancer research connections to the community. Ms. Dowe graduated from the University of Michigan School of Public Health before beginning her career as a public health professional in Detroit. Her areas of expertise include program development and program management, survey development, quantitative and qualitative research methodologies, and community organizing theory. And our last presenter is Vanessa Brown-Miller, Manager of Community Engagement. And Vanessa is the Manager of Community Engagement at the Office of Cancer Health Equity and Community Engagement, again, OCHECE, at the Carmona Center Cancer Institute in Wayne State University in Detroit, Michigan. Thank you there. Vanessa earned her degree at Michigan State University in the area of health science and child development, extended study in child development at Merrill Palmer Institute of Detroit, Michigan. She has been working in the area of community health care for the past 20 years. She is the former director of health disparity programs at former Great Lakes Division of the American Cancer Society, where she trained division staff on identifying health disparities in underserved communities. In her role at OCHECE, Vanessa has assisted in the development of Michigan Cancer Health Link and their Cancer Action Councils, which I think we'll be hearing a great deal about today. So welcome to both of you, or all of you. So really quickly on the agenda, again, we're very thankful to be here today. I'm going to provide a little bit about the Aging Learning Key Core Collaborative, and then I'm going to define for you what we mean by engaged research so that we can set up a conversation about two key funders in this area, both the Patient-Centered Outcomes Research Institute, or PCORI, and the NIH National Institute of Health funding the Healthier Black Elder Center. So we're going to talk about two specific funders of engaged research, and then we're going to give you a very concrete engagement and action kind of case study where the team will walk you through some engaged research activities that are already happening and are very exciting. So that's our plan. Before we go any further, I want to recognize the Aging P-Core Learning Collaborative as a project. The Aging P-Core Learning Collaborative is funded by the Patient-Centered Outcomes Research Institute. It's actually our third or fourth funding opportunity from this funding entity, and we're very thankful for the PCORI Institute, or Patient-Centered Outcomes Research Institute, or PCORI, for the funding that we've had to date. Our project very specifically is a collaboration between our team at Collective Insight and the Leading Age LTS Center at UMass Boston. I see Dr. Mark Cohen on the presentation today. He is my colleague and partner in crime on this learning collaborative. We've been doing this now in some shape or form since, 2019, where we had a convening meeting project grant in the middle of COVID. But Collective Insight is a group that does a range of effective engagement strategies in policy and research. And I am a policy and research fellow at the Leading Age LTSS Center, which actually brings together Leading Age, UMass Boston, and Community Catalyst. I think many of you are familiar with Community Catalyst, which is an health advocacy organization. So quantitative and qualitative research, applied policy activities to really advance long-term services supports and aging topics across the US and global. So a very exciting initiative. And I'll talk a little bit more about the Learning Collaborative soon after. So what is engaged research? We're using that term broadly in this presentation to really mean involving anybody with lived experience in the design, implementation, and dissemination of research. So what it is, when we think of engaged research, we think of engaging people with lived experience, and our work specifically older adults, as research partners, not just research subjects. We really are thinking about engaging older adults and other community partners that support older adults in all research phases. So not necessarily just in implementation, but also design of research questions, and maybe deciding on methodologies, refining methodologies, then even presenting or writing up findings, and helping us disseminate those findings. So when I think of engaged research, I also think of two concepts that I think are really important regardless of how you implement it, and that is being flexible. If we come in as researchers with ideas about what we think are important research projects, thinking about ways to listen and learn from communities what research priorities are there, and to be flexible in how we really what research questions we go after, but how we also do that as well. And then, of course, if you're going to do engaged research, it's also about being accessible, making sure that our research process uses plain language, and that we are really taking the opportunity to educate people about research topics or research methods, but then also listening and modifying our methods based on that. So what it is not just qualitative research. I think oftentimes when we think about engaged research, we think about it for qualitative methods. I would think that there are actually quite a few strong qualitative researchers that are really good at engaged research, but we also have seen quite a few projects in our work that are quantitative in nature. So it does not necessarily mean qualitative research only. What it is not necessarily is just focus groups or interviews as data collection methods. While we in engaged research might often decide to do focus groups or interviews as data collection methods, they themselves are not engaged research. The engagement comes in the working with people with lived experience to actually prioritize the research, design the research questions, decide the methods for which it might include focus groups, interviews, and other types of engagement activities like that. Oftentimes I see people defining engaged research as presenting your findings maybe to a broader community after the fact your research is done. While that might be an important part and often done with communities, that in itself, I would define as merely engaged research. And then last but not least, doing what you originally wanted after you engage communities is not typically thought of as engaged research. So if you have gone through a process and you've noticed that your methods have changed based on involving or listening to communities with lived experience, then you are probably doing engaged research of some sort or level. Next slide, please. There's a lot of controversy, I think, within various disciplines on how different or alike terms are and approaches for engaged research. I have a few names of engaged research methodologies or disciplines or frameworks that I would consider engaged research. Some of them coming from more of a sociological background or discipline, some coming from a more medical model, some for the US and some from other countries like the United Kingdom. I would think that it's just important to recognize that while how engaged research might be done can be driven by different disciplines, the concepts are usually similar. And that is, like I had mentioned, engaging people early, often, and throughout your research to refine your methodology and to improve your methods. Next slide. So as I mentioned, this shouldn't be a surprise. On the right-hand side are some examples of where you might involve communities in engaged research activities. So designing research questions, developing research materials, data collection strategies, interpreting your findings, writing reports, and presenting and disseminating results. You would see it happen with different models. So for instance, in some research, you hear of what I would call the like a co-principal investigator model, which we see a lot at PCORI, advisory board structures, which we'll hear about today, community forums. There's a lot of different methods of engagement or different structures of engagement. And I think oftentimes the strongest engagement strategies are a mix of these methods. So there isn't a kind of a one size fits all. And it really depends on probably the capacity of the researcher, the funds that are available, even the funder and what they expect, how engaged research is implemented. So I'm going to talk briefly about the Patient-Centered Outcomes Research Institute, and then we're going to give you another example. Vanessa is going to talk a little bit about the National Institutes of Health. But PCORI funds a few different options, and we can put these links into the chat when I'm done here. But PCORI really funds research itself, so patient-centered outcomes research. And when they define patient-centered outcomes research, they're really talking about identifying topics and engaging patients and users of service in the prioritization and implementation of that model. They often implement co-investigator models like we just described. They often also often fund advisory structures. I think it's important to know that they have funded older adult research quite a bit, specifically around health disparities research. They've done chronic conditions research. They've done research with older adults in rural communities. They've done cancer research. So they definitely do fund what I would call engaged research concepts. They also fund capacity building, which is what we are doing right now. So the Aging Peak Learning Collaborative is part of the Eugene Washington Awards, which we are helping what I would call shift the paradigm, where we are working with researchers and funders specifically for aging in our project, where we are building capacity with researchers, with students, with older adults. They fund capacity building is one example. They also fund meetings or convenings. So if you're getting ready to think about engaging communities in a research project, they will fund, if you put forth a proposal and do it well, they will fund a meeting or two for you to initiate those conversations and refine your projects. I would say for PCORI, the focus is competitive effectiveness research, and they've been even more focused on that more than ever, I think. So if you're going for PCORI funding, you're really going for a very specific model of funding, model of research, and they're looking for other groups like NIH to fund more broadly beyond patient-centered outcomes research. So next slide. So let's see, I'm going to go ahead and I'm seeing I'm short on time. So Aging Peak Learning Collaborative, like I had said, it's really about moving the paradigm from traditional research methodologies to more engaged research. And we're doing this because we really do think that students and researchers need additional skill building and knowledge building to be able to do engaged research, right? We also are working with funders because we think that a lot of the funding portfolios themselves don't provide a lot of opportunity for engaged research. And so we're working with funders as well to make sure that they are doing this well. So that is enough on the Aging Peak Learning Collaborative. You can find more on what we do, more specifically our podcast series, our video series, and our training support and resource library, where you can access information on engaged research, training resources, skill building. We also provide mentoring and support. So if you want to go on there and find a way to seek our assistance in the future, maybe help you figure out an engagement plan for future research, we're here to help you. So I will add those links onto the chat in a few minutes. And I'll also show how you can join our Research Aging Network, which is a network of researchers, older adults, and funders trying to advance engaged research. So thank you. And I'm going to move us along. Vanessa, you're on.
Thank you. Thanks, Erin. Good afternoon, everyone. I'm happy to be here, and thanks so much for inviting me and having me be a part of this. My name is Vanessa Rorai. As Erin mentioned, I'm the coordinator for the Healthier Black Elder Center, which is located through Wayne State University in Detroit, Michigan. So I'm going to give a brief overview of who we are, what we do, as an example and sort of an existing resource that folks can tap into to engage older adults in research. So I'm going to start sort of backwards at the NIH end. Our program started in 1997. And at that time, the National Institute of Health created a funding mechanism to create centers across the country. And I'm going to share more about these centers in a minute. But essentially, they recognized that there was a need and gap to increase participation of minority community members in research, but also to train scientists and researchers that are either minorities themselves or working and doing work with minority populations. So that's sort of how our center was created. So if you look at our circle logo, that kind of gives a map of how we are formed. So our center, based in Michigan, we are the Michigan Center for Urban African American Aging Research. So our population of focus is older African American adults. And we have 3 universities that have come together to coordinate our center. So we have Wayne State University, the University of Michigan, and Michigan State. Our center, MUCWAR, which we call for short, has different cores. And our program, the Healthier Black Elder Center, lives in the community core. So we are community facing, engaging, and do the work with the community through there. So we have a research registry of a little over 1,100 older African-American adults that have become members of our program. When they become members, they are invited to participate in research studies. I will say when the program started in 1997, we definitely took our time before we got to the point of research. So we spent the first 7 to 9 years just doing outreach, doing community education, connecting with community organizations, community groups. And then once we built that relationship and sense of trust, then we created the research registry. We do a ton of community events. We call them lunch and learns. We bring speakers in, they present on different health topics. We invite our members to attend. We do health screenings, serve lunch, have resource tables. And it's a really nice way for us to thank our members for being in the program by giving education and lunch. And really, you know, our whole center is funded to be a resource for researchers because we have a formal application process where researchers can apply to use our registry to recruit for their studies. And you'll see in this last bullet point, we have a community advisory board. They are the backbone of our center. It's 16 community members. They receive an annual stipend for being on the board, and they are our program leaders and decision makers in pretty much every aspect of our center. So whenever I talk about our program, I really emphasize technically I have 16 bosses. They give me direction of what they want to see for the program. And that is the key part of our engaged work. So they decided the name Healthier Black Elder Center. They decide the topics of our lunch and learn events. We have a biannual newsletter we mail to our members. They help me choose the articles that we include in there. The formal application process that researchers submit, the board members designed that application. They designed the questions that they want researchers to answer when they're applying to our registry. And most importantly, they are the reviewers and the ones that decide ultimately who gets access to our registry to recruit for their studies. So they really are sort of like the gatekeepers of the program. They're also our community ambassadors. So they spread the word about the program within their own networks, other community groups that they connect with. They are absolutely vital to our program. Next slide, please, Missy. So these are these other centers, and I share this to show you that sometimes researchers kind of get overwhelmed when they start to think like, how can I engage older adults in my work? And I share this with you to show that there are tons of existing resources and programs already in existence to help you achieve that. So you don't have to start from scratch. You don't have to reinvent the wheel. This is what NIH funds us for, right? So these centers, the mechanism that NIH funded is called the RCMAR centers. So it's the Research Centers for Minority Aging Research. If you click on the link, you'll get a much nicer layout and be able to read up on each center. But essentially, you will see they are across the country. Each center focuses on a particular population or disease. So most of them are Alzheimer's and related dementia focused and not necessarily population focused. But you can see in this map, find a center near you. We are very similar in our structure where we have community cores and then like training mentorship cores. We slightly vary, but I would say take a look, see if there's one nearby or in a population that you're interested in connecting with, and reach out and see, you know, how you could potentially collaborate or use them as a really great resource. Next slide. Okay, so just some really quick examples of how work can really benefit when you engage older adults. I think, just how our whole center is structured is a great example, but there are so many little things that we have just expanded and grown and changed throughout the years because we're constantly engaging our board members to give us feedback in shaping our program to meet the needs of the community. So during the height of the pandemic, we did a really big telephone outreach project where we contacted all of our registry members to check in, see how they were doing, did a telephone survey with them, and a lot of things came out of that. One of them was we created an online weekly social group called Party Line. A lot of our members loved being able to get education through our Lunch and Learn programming, but they really just wanted an opportunity to socialize with their peers and talk about anything and nothing. And so we created a weekly Party Line program for them. Critical Crossroads is a new segment that we added to our Lunch and Learn programming. This comes directly from our board members and it addresses social determinants of health. So we have had mini presentations on gerrymandering, access to voting, police misconduct. We had last year major flooding that happened in our area, Metro Detroit. So we did a presentation on how to apply to FEMA for flood damage. Again, our board members give us feedback on Lunch and Learn topics. There's no point in connecting with a community if it's something that they are not interested in, is not going to be relevant to them, it's not going to benefit them in some way. And then lastly, we launched a consultancy program in 2020, which is really nice extension of the registry where our board members are now consultants. And so they meet one-on-one with researchers to consult on, sometimes it's a particular part of your study. So if you want them to consult on your questions, your research design, your outreach methods, or they also are presenters where they present at symposiums and webinars on best practices of how to engage older African-American adults in research. The last thing I would say is sometimes engaging older adults in research can really help overcome barriers or challenges to recruitment. One example is the Wallet study that I'm coordinating. The Wallet study is we are analyzing older adults' bank statements to try and get a better understanding of how older adults manage their finances and make financial decisions. Talking about finances is a really taboo topic for a lot of people. So how do you overcome these sort of challenges and barriers to doing work that might be a sensitive topic or really hard to recruit for? So utilizing the Healthier Black Elder Center registry has significantly increased my recruitment success because I'm utilizing an existing trusted relationship, an existing group of folks that are interested in participating in studies. Next slide, please. So we are going to share the slides. These are just links that might be helpful, might be useful. You can see the RICMAR centers, you can see our website. Our registry is open to researchers across the country to utilize. The pandemic has really pushed us to be more electronic. So now there's so much research that can be done remotely, which is fantastic. You can take a look at our PRP survey. So that is the survey that all of our members complete when they join the registry. The answers they provide on that survey determines which studies they may be eligible for. It also gives me the opportunity to create a custom tailored contact list for researchers that are approved to use the registry based on their study inclusion and exclusion criteria. So you can take a look at that. All of our webinars are recorded and posted on our website, and you can take a look at our newsletter just to see a little bit more about who we are and what we do. So happy to answer any questions, and thank you so much. And I think now I will pass it on to Brittany and Von Seal.
Thank you, Vanessa. Hi, everyone. Thank you again so much for having us today. As Erin mentioned at the beginning, my name is Brittany Dowe, and I'm joined by my colleague, Von Seal Brown-Miller. Our presentation today is titled Building a Community Academic Partnership, Michigan Cancer Health Link and the Cancer Action Councils. On this slide, you'll see an agenda for what we'll touch upon today. I will go into some background on Karmanos in our office and then talk about Michigan Cancer Health Link and the Cancer Action Councils or CACs. Next slide. So just to start, I did want to give some background on Karmanos Cancer Institute, or KCI, as we like to call it. KCI is a National Cancer Institute NCI designated comprehensive cancer center with headquarters in Detroit, Michigan. And like all other comprehensive cancer centers, we are funded by the NCI Cancer Center Support Grant through Wayne State University, or WSU. Next slide. This slide goes into some background on Karmanos's, or KCI's catchment area. Our cancer center has a catchment area of 46 counties. I like to do little mittens, so the whole east side, thumb side of the state of Michigan is our catchment area, which is approximately 6.7 million residents. Karmanos serves 31% of new cancer patients in our region. And across our region, there are 15 treatment locations. So it might be a little bit small on your screen, but every dot that is on that map of Michigan is one of our treatment sites. Some key characteristics that I wanted to share about our catchment area include we are anchored by the city of Detroit, which is the largest city in the catchment area, where approximately 78% of residents are African American and approximately 35% of residents fall below the poverty level. We have a very large Middle Eastern, North African, or MENA population in Michigan. And then we also 4% of Michigan residents identify as sexual and gender minorities, or SGMs, and we're among states with the highest proportion of African American SGMs. Next slide. So the Office of Cancer Health Equity and Community Engagement, or OCHECE, has the primary responsibility for community outreach and engagement at Karmanos Cancer Institute. Our office was established in 2017, and we're led by our Associate Center Director for Community Outreach and Engagement, Dr. Haley S. Thompson. And to learn more about our work, our website is on the screen and a link will be posted in the chat. So I'll now turn it over to Vanessa, who's going to talk a little bit more about the Health Link model and Michigan Cancer Health Link.
Thanks, Brittany. So yes, the Health Link model. Really, this is a model of academic community partnership and participatory research. And it is a model that's directly taken from a model that was similar that comes out of Queens, New York, and was done with the partnership of the American Cancer Society and the Albert Einstein College of Medicine. And this collaboration was done through 20 libraries where they had cancer action councils developed in these 20 library systems, and they delivered program based on what the community wanted to see happen. And based on what I understand, and this is a program that really helped launch our cancer action councils, their programs are still in existence. I'm going to move you up just a little bit, Brittany.
Oh, we jumped ahead a few slides. Can we go back?
I know what happened. Can you, I won't touch anything else on so our Michigan Cancer Health Link and our Cancer Action Councils, really, we started and then we established these councils in 2016. The councils are made up of survivors, caregivers, and advocates who represent diverse populations and geographic areas. And we'll talk more in detail about those in a moment. Right now, OCHECE, the Office of Cancer Health Equity and Community Engagement, currently supports 11 cancer action councils with over 91 members across all the groups. In 2017, we were acknowledged by the Michigan Cancer Consortium for the Spirit of Collaboration Award. And that's because of the uniqueness of our councils. We are councils that are established through a research lens. Next slide. It's jumping.
Yes, could you go back one more, Missy? There we go.
Okay. So we initially started with 3 councils, Arcana Creek and Western Wayne, and at that time we had a Karmanos Cancer Institute Council. were our first 3 councils that we established. And the main thing with these councils is that, you know, they are established through partnerships within the community. So for Connor Creek, for example, we have Voices of Detroit initiative. They helped us establish Connor Creek, as well as Western Wayne Family Health Center that helped to partner with us to establish the Western Wayne Inkster Cancer Action Council. Since that time, we have councils that were developed in Dearborn with Access Community, which is primarily MENA community, Arabic women, and this particular council is made up of breast cancer survivors. We have our LGBTQ community, which is now statewide, and Oakland County, Macomb County, and Genesee County all came on around the same time, around 2018. And you can see their respective partners: American Cancer Society, Macomb Health Department, and R.L. Jones Community Outreach. And then right in the middle of the pandemic, we established Black Men's Cancer Action Council, which their partner is Tabernacle Missionary Baptist Church. So we were really excited to get that council started. And just for the first couple of years, we didn't even meet in person. We met via Zoom the whole time, which was quite an accomplishment. And then we have our young survivors, and our partner there is Gilda's Club, really dynamic partner, and our Rural Michigan Council, which is another dynamic group that really is opening our eyes to the many challenges that the rural communities have around cancer care. And then finally, our Genomic Research Action Council, which is a faith-based group, and our partner there is our faith-based Genetic Research Institute.
So we did want to acknowledge the funding that led to the CAC creations. Several different funding agencies have supported the work of Michigan Cancer Health Link to support the expansion and the creation of new cancer action councils. Those initial councils that Vanessa was talking about, Connor Creek and Western Wayne, were funded in 2016 from a Patient-Centered Outcomes Research Institute Engagement Award, a PCORI Engagement Award. And we actually have received quite a few PCORI awards to start some of our groups, as you can see on this slide. Next slide. So in terms of building our cancer action councils or CACs, we always find it really important to have that community-based organization or CBO that helps to host the Cancer Action Council. Like Vanessa said, that was integral to starting the first councils, and with all our work, we really want to establish a partnership. So to identify a CBO, once we have identified a community-based organization or CBO, we clearly outline the organization's role in a memorandum of understanding or MOU. The CBO is also usually the meeting site for the Cancer Action Council. So before the pandemic, all of our Cancer Action Councils did meet in person monthly. And then it's also useful, we found, to budget funds to cover the time of a CBO staff member who will support the Cancer Action Council. So that individual usually helps with co-facilitating the meeting. They can help give out stipends to members, things like that. Also, the CBOs are also instrumental in identifying and nominating potential Cancer Action Council members in addition to other strategies. Next slide. So in terms of identifying our CAC members, our team developed a selection process to ensure a good fit. So like Vanessa said, all of our Cancer Action Councils are made up of survivors, caregivers, and advocates. We created an application that asks about demographics, commitment, and availability, one's cancer experience, as well as other relevant community experiences. We also ensure candidates are prepared for the discussion of sensitive topics. We know cancer is very personal. And then applications gave insight into potential makeup of the group. And then after an application is completed, the candidate is interviewed by one of our team members. Once all of the potential applicants are chosen to be CAC members, we clearly outline that member's role in another memorandum of understanding or MOU. Next slide. So I'll turn it back over to Vanessa to talk about exactly what our Cancer Action Councils do.
Well, so I always say that establishing a Cancer Action Council and for a Cancer Action Council to be successful, it's a process. And this is part of our 4-step process. First of all, we're building the capacity of community members to understand research, understand what it is, how it functions, how it can function within their communities, the input they can have. And this is a skill building portion that once they have completed this portion, is a
Did we? Oh, there you go.
No, I think she's frozen, so I will jump in. So like Vanessa was saying, our Cancer Action Councils are established with research in mind. Oh, are you back, Vanessa?
I don't know. I can't tell that I was frozen.
Oh, you were gone for a moment.
Okay, I'm sorry. I'm sorry. And it's showing here that my internet connection maybe not be so stable. I did end with the capacity building aspect of the Cancer Action Councils, and the fact that it is patient-centered, and the community just really seems to appreciate being heard and understood in this space. And so and really listening to their concerns. We established what their concerns are, and then through concept mapping, we actually drill down into those particular concerns and come up with themes, and then come up with research questions. And this is a part of the process that I find that the Cancer Action Councils truly enjoy, because it's interactive, and they are being heard, and they can see that this process sort of unwinding. And then building research partnerships and relationships. And this has everything to do with just taking the mystery out of research. It's having researchers come and talk about their research, and also the council members giving them input on what they think is good or not, or if they're on the mark or not. And I have seen so many researchers grow in this area just from interaction with our Cancer Action Councils. And so research projects have been changed, and they have been the better for it. And then it's the dissemination of information. And one of the unique things, aspects of Cancer Action Councils, is that the fact that once they have learned certain information, they are free to share information back to their communities. And so suddenly they become more of an expert on the issue of cancer and research, and the latest and greatest of information is sort of coming down the pipe that we share with them. And they're more confident, and they're confident even as it pertains to their own cancer, if there is a diagnosis for themselves or loved ones or friends. And so they have put symposiums on, and we have our All Cancer Action Council, and we'll talk more about that in a moment. Next slide. So building your capacity curriculum, which was taken from the Tufts CTSI curriculum. And this curriculum was modified to reach and teach a lay audience. It was adapted by the Michigan Health Link for cancer prevention and control research. And it is extremely effective in sharing basic research information in a formal curriculum to our council participants. So what it does is provide participants with basic understanding of the academic and research process. It familiarizes them with research terminology and concepts, and increases their overall level of confidence in engaging with academic researchers. Next slide. So this is the curriculum. We call it Research 101, but it covers all aspects of research, and from the introduction of research and evaluation all the way through right granting, proposal writing, and policy and advocacy. It takes about a year for us to complete this process. And this is happening simultaneously as they're coming up with their research questions and doing their concept mapping and really deciding what's important to them as it pertains to research experiences. So the way that we sort of help them get through this process is through evidence prioritization. And so how we do this is that we use our cancer continuum, which sort of lays out the experience of cancer all the way from the risk assessment all the way to end of life. And once you it just helps them categorize their concerns so that we're covering all aspects of cancer through the cancer continuum. Next slide. Steps 2 and 3, they actually, through brainstorming and sharing of their cancer priorities, they actually do concept mapping. In the beginning, we started our concept maps on paper, and they were actually, put their main subject in the middle and then sort of drill down into what some of those main concerns were, and then coming up with themes and actually developing research questions. This truly is the best part of their program. Go ahead, next slide. So this is a current concept map, and I would say this is a concept map that once the pandemic sort of set in with us, we started using Miro to help with our concept mapping. And you can see that we're able to do a little bit more with that. So we have this main subject in the middle, and then it's color-coded based on themes and subject area. And we're able to, from those themes, come up with actual research questions. This group had medical mistrust as one of their key areas, and recently have put on a symposium around medical mistrust. And it came out of these concept maps. Next slide. So each of our CACs develop their own research priorities, and we try to get them to their top 3. And here are a couple of examples. So for our Connor Creek group, which is on the northeast side of Detroit, their concerns was cancer patient navigation, cancer caregiving, and cancer patient psychological well-being. They are working now on a cancer caregiving guide. Our Oakland County CAC priorities were cancer screening, technology, genetic risks and communication, along with technology. And they are currently working on a technology project with a researcher from Wayne State University. And Black men, as I said before, they had cancer information, financial toxicity, and medical mistrust, and just recently put on a symposium around medical mistrust. Next slide. One of the ways that we thought would be interesting for us to bring all our CACs together, we we started off with about 8 coming together in 2019, and we came up with our first big idea, which was a financial toxicity, which has led to a funded project called My Cost. And then now our new big idea is cancer caregiving. Great way for them to have camaraderie. Thank you. I'm turning it back over to Brittany.
So just quickly to wrap us up, for our CAC research projects and partnerships, like Bonsil said, our CAC members, once they get through their building the capacity curriculum, as well as their concept mapping, we identify those priorities. They do get paired with researchers to work on projects, or researchers at Barbados and Wayne State not only see the value in our CACs, but want to create their own community stakeholder boards, their own cancer action council. So this just lists some of the projects that our CAC members have been involved with. Next slide. And then quickly, I did just want to end on some evaluation data. So each year, our CAC members complete a partnership evaluation assessing the Health Link model and the CACs. From 2022, we had 66 out of the 91 members complete the partnership evaluation. And some of the items that we asked about are sense of involvement and belonging, individual influence, satisfaction with the project, staff, as well as the project overall, and then with the CAC. Next slide. For today, I just was going to show 2 areas. So in terms of research involvement, how likely are you to get involved with other cancer research programs? Our CAC members, 93, almost 94% said that they were extremely likely/likely. Seek out new research programs related to cancer. Almost 88% said that they were extremely likely or likely, or seek out other research-based programs that engage or involve community members. Almost 94% again. Next slide. And then in terms of satisfaction, how satisfied are you with the following? The process used by the CAC to create research priorities and generate research questions. 86% said that they were very satisfied or satisfied. The programs proposed to meet objectives, almost 91%. The level of CAC member involvement with program activities, 86% again. And then overall CAC functioning, 87.8%. Next slide. So that's it. Thank you all so much.
Thank you. That was a wonderful presentation with a wealth of information. My reaction straight off is that we overlap in many areas in terms of similar efforts that are going on here in Boston between UMass Boston and the Dana-Farber Harvard Cancer Center and all of the community work that we do. But there's so many other initiatives that I see going on in Michigan that you've undertaken. And I'm sure there are investigators here who I will suggest view this and talk this up and reach out to you. I think it would be wonderful to meet, share ideas, and potentially collaborate in areas of engaging not just older adults, but communities overall.
We would be very interested in that, definitely.
Does anyone have any questions? I think you can unmute yourselves. I also would like to note that you mentioned how long it takes to establish these community relationships. And that is something that we have stressed to folks too here in the Boston area, that 2 things. One, it's time consuming to and a lot of effort to develop those relationships. And it's also very important not to helicopter into a community and just use the population and helicopter out. That can do a lot of damage. Have you found that too?
Yes, that's something we definitely keep in mind as we're building our cancer action councils, as well as picking a community-based organization, a CBO, want to make sure, and I think the MOU can really help with that as well, that the expectations are laid out clearly. So we're saying exactly what we're going to do for that organization. And they're saying exactly the ways in which that they can help us. So it's all about ongoing conversations, I would say, too, right, Vanessa? Oh, Vanessa fell off, but Vanessa, I think you would say the same thing for the communities that you work with.
Yeah, and I think unfortunately, sometimes researchers see that as a deterrent because it is time consuming and it can be a process to establish these trusted relationships. But that's why we have programs like ours and the ones that Brittany coordinates. They're already in existence, they're already running. We've essentially done a lot of the legwork as a resource for researchers to tap into and utilize.
I think that's interesting as a core also, because when we run into the grant cycle problem, it's 3 years, it's 5 years, by the time we get everything up and running, and now, okay, we're ready to go out to the community. The grants don't have time, the teams don't have time to establish the relationships, so it's nice to know that there's something to go to as a resource. And you've got community advisory boards, you have a registry set up. That's incredibly helpful for investigators. Okay, if I don't see any other questions, as I mentioned, this will be posted. I've had people email me and text me asking if it will be posted. And so we will put this on the U54 partnership website, and we will also share the slides. Thank you, Erin, for putting so many of those links in as we went along. The slides contain the links, and as I mentioned, please feel free to reach out to the presenters and collaborate away. Thank you all.
Thank you.
Bye-bye.
Bye.